Hi, I'm Lisa, the Project Officer, and joining us today is the Project Manager, Stephen Manley. The Clinical Editor at the North Coast Primary Health Network, Dr Hilton Coppy, also works locally in the LHD as a GP, but unfortunately he's not able to be here today. In Australia, ovarian cancer has the 9th highest incidence and 6th highest mortality of cancers in females. Measures, including mortality, are known to be higher in regional areas compared to metropolitan comparators. This is closely related to the level of access that regional patients have to high quality care and services. Northern New South Wales LHD has a growing population and projected increase in cancer incidence. Northern New South Wales has 2 main cancer centres and a number of satellite centres providing chemotherapy and radiation therapy. However, the majority of women with ovarian cancer are treated with surgery. Surgery for ovarian cancer patients is provided by services outside the LHD, predominantly in Queensland. Both public and private providers are utilised by ovarian cancer patients in the LHD. Northern New South Wales covers a large geographic area and encapsulates a diverse demographic. In Northern New South Wales, there may be delays in diagnosis due to a number of factors in different population subsets that can adversely affect the outcomes for these patients, particularly if delays in diagnosis result in the upstaging of disease. We have conducted previous work in localising the optimal care for lung cancer pathway, and a number of identified key engagement strategies were utilised in the development of an ovarian cancer pathway, along with other cancers that can be impacted by optimising diagnostic and referral patterns. North Coast Primary Health Network spans both Northern New South Wales and Mid-North Coast LHDs, and any published pathways need to be applicable to both LHDs. Cancer Institute New South Wales have provided funding opportunities through its competitive grant schemes, and these have enabled us to commit stable resources to localise optimal care pathways across Northern and Mid-North Coast New South Wales LHDs. The project's primary aim was to develop an evidence-based, localised pathway that supports primary care and specialist service providers to optimise the management of women with ovarian cancer, including diagnosis, referral, treatment, follow-up. Patients across the state, regardless of geographical location, should have the same access to services in a timely manner. Not all services are available within the LHD, and the pathway aimed to expedite patients' timeframes by identifying the steps in the referral pathway and who precisely to refer to. This project provided opportunities to build stronger working relationships within and external to Northern New South Wales to ensure optimal care is provided to the population of this region in an efficient and coordinated manner. This project's methodology consisted of several stages. Pre-implementation required identifying and engaging stakeholders. Throughout the entire project, effective stakeholder engagement with primary and specialist care clinicians in New South Wales and Queensland, private and public practice, was critical to determining the optimised localised pathway. Current service mapping was undertaken with clinical stakeholders. Patient record reviews and patient interviews assisted with verifying the mapped service and provided information regarding what was actually happening within the services and in what time frame. The Cancer Care Pathways Mapping and Dissemination Toolkit, published by Cancer Institute New South Wales, provided a framework that was adapted to suit local project requirements. High-level engagement from clinical stakeholders was essential in determining the key deliverables as the project evolved. Referral to specialist surgical services is well utilised, efficient and robust. Specialists in and out of LHD were satisfied with the current service. However, issues surrounding psychosocial care and support for ovarian cancer patients were identified at several points in the mapping process by several stakeholder groups. In particular, some patients only receive treatment out of the LHD and upon returning home may not be connected to local services available. This led to the development of a psychosocial care in cancer page that encapsulated all cancer patients in the LHD. This page is intended to aid GPs to assess and assist with the psychosocial needs of cancer patients. This aspect of a GP's role was deemed crucial by both primary and secondary care specialists throughout the project. A Cancer Services Directory works in conjunction with the psychosocial care pathways to facilitate GP referrals or patient self-referrals to local services that are provided by numerous organisations. This was a unique type of pathway that encountered some uncertainty from the Health Pathways team. However, the project team and stakeholders felt it was beneficial and ensured its publication. 3 distinct ovarian cancer pathways were published: diagnosis, established, and follow-up, to cover all components of a patient's cancer journey. These pathways facilitate GP's referral to the appropriate specialty for diagnosis when required, provide educational information to a patient, as well as assist with identifying red flags to look out for during the follow-up phase, which may require a referral back to the treating team. Non-cancer pathways were developed to support the ovarian cancer pathway, such as symptom identification. For example, ovarian cyst or familial ovarian cancer syndrome pathways with links into the ovarian cancer pathways. Service pages for gynae and gynae oncology services were developed, providing localised referral information. The psychosocial care in cancer page was embedded into the ovarian cancer pathway and is now single-sourced for all cancer pathways published on the Health Pathways platform. So the diagram shown explains how all these pathways interlink to facilitate the complete care of an ovarian cancer patient. Symptoms can be searched in health pathways, for example, bloated. It's not expected that the automatic assumption of this symptom is ovarian cancer, and other various diagnoses will pop up. However, other symptomatic pathways such as the ovarian cyst pathway link into the ovarian cancer pathway. The clinical pathways such as the ovarian cancer diagnosis provides links in the referral section to the acute gynecology assessment page, which lists providers and how to refer. The clinical ovarian cancer diagnosis pathway links to the ovarian cancer established and follow-up pathways, as well as associated pathways that can assist the GP, such as genetic services and psychosocial care in cancer. Now, the patient record review had limitations due to cross-border issues and public and private service providers. Whilst this quantitative data had limitations, the qualitative data collected from patients and specialists was rich and consistent, whereby service expectations were being met or exceeded. A suite of localised ovarian cancer pathways provides a tool for primary care specialists to deliver the right care in the right place at the right time. This project delivered a tool to improve the management of ovarian cancer patients and potentially provide an improvement in their clinical outcomes. Northern New South Wales LHD and the North Coast Primary Health Network have established a strong relationship in the development of cancer pathways that will have a broader benefits to our regional communities. The continuous work on localising optimal care pathways has led to improvements in project methodology and application within Northern New South Wales LHD. When interviewed by the GP magazine Health Speak, Dr. Copy gave an example of the pathways implications for local GPs. I'll invite Stephen to relay Dr. Copy's message.
The other week I saw Muriel, a 75-year-old woman who was complaining of vague lower abdominal discomfort and bloating. She had mild tenderness in her lower abdominal region, so I arranged for her to have an ultrasound. This showed a 3 centimetre right ovarian cystic structure. The radiologist did not report any sinister findings, but due to my involvement in a work group developing health pathways for ovarian cancer, I was aware of the risk of malignancy index for assessing risk of ovarian cancer. Muriel agreed to have CA125 done to further quantify her risk. When this came back raised with associated elevation in RMI score, I knew from my work on the relevant health pathway that I needed to refer her directly to a gynecological oncologist. Plus I knew that health pathways had up-to-date contact details for these specialists. It's possible that most other GPs already knew this information, but I didn't. Without access to the published pathways, I'm not sure that Muriel would have received optimal treatment in an appropriate time frame.
Thank you, Stephen. So, outcomes. Stronger relationships were developed between primary care providers and hospital-based cancer services via this project. Effective clinical stakeholder engagement expedited future cancer pathways, and since the completion of this project, cervical and endometrial cancer pathways have been published. A range of dissemination approaches were applied to gain maximum exposure for the published ovarian cancer pathways. At the PHN Women's Health Screening Conferences, gynae specialists formed a panel and the PHN clinical editor facilitated a session whereby an ovarian cancer patient's journey to the primarily GP audience was demonstrated. These published pathways were used as support to highlight crucial information located right at their fingertips, literally on the desktop and a few mouse clicks away. I'm going to skip a little bit because I have to wrap up. So in summary, the Localising an Ovarian Cancer Pathway is in a regional setting project achieved its primary aim, which was to develop an evidence-based, localised pathway for use by primary care and specialist service providers to optimise the management of women with ovarian cancer. In addition, many other outcomes, as mentioned, have resulted in a robust suite of gynecological cancers and associated pages. Cancer Pathways work is ongoing, continually evolving and leverages off prior work. The PHN promotes the use of the Health Pathways platform to GPs. Further additions to the suite of Cancer Pathways on the platform aims to increase its value by GPs as a relevant resource and encourages Health Pathways as a go-to for cancer patients. Thank you.
Thanks, Lisa. We're doing a couple of these localisation projects at Southern New South Wales, where I work as well, and I'm glad to hear other people have cross-border issues. But I was wondering, it's all very well for us to develop these pathways, which are extremely useful, of course, and available to everyone. Whether they actually get used is another thing, and I'm just wondering. I don't really have any sense of how well they're used in our LHD. Do you have a sense, and how perhaps we can encourage better use of them?
So that's a question in terms of how do we measure that these pathways are being utilised and are effective. The PHN can measure click counts on the pathways, but because the platform has a generic login, we can't tell who's logging in, looking at the pathways. It could be me, it could be the GPs, but we are unable to tell how many people are looking at it. And then secondly, how do you tell that that's being effective? It's something the PHN are aware of and something they're trying to work on. But the PHN take on the responsibility of encouraging and pushing health pathways to the GP population. So from our point of view, we can put it on there and then hopefully they're putting it out there.
Are there any other questions for Lisa? We're running ahead of time, which is great.
Thank you.
No other questions? Thanks, Lisa.
Thank you.